Well, we told you Rosen Hotels and Resorts founder Harris Rosen is going to be offering what he calls RosenCare to Osceola County School District workers. That's going to start in October. The deal is a first of its kind for RosenCare. And joining us this morning to talk more about how this works is Kenneth Aldridge. He's the Medical Services Director at Rosen Medical Center. Good to see you, Kenneth. Can you hear me okay?
I can. Good morning.
Good morning to you. So first, give us a little background on RosenCare for people who don't know what it is.
Yeah, so RosenCare was actually established 28 years ago by Mr. Harris Rosen. He got tired of the traditional health insurance model and decided to go self-funded. And at that time, he developed his own little clinic. So basically, RosenCare evolved over 28 years from a tiny clinic to a facility that is a medical center that's 12,000 square feet that serves employees and the dependents of Rosen Hotels and Resorts. And that's about 6,000 covered lives under our plan.
Wow, incredible. So Harris Rosen actually employs doctors, nurses, techs, all of that.
You are absolutely correct. I mean, it is a comprehensive medical center that not only includes the physicians, nurse practitioners, we have a chiropractor, we have a podiatrist, we have ultrasound, radiology, we have a fitness center, we have physical therapy. Everything's on site. I mean, the whole program is established to make sure that we can provide every service, or as many services as we can, for our employees and the dependents of Rosen Hotels and Resorts.
Okay.
I mean, even Mr. Rosen, he put this program together where he brings the employees, they'll drive the employees here on the clock. So we've removed the access, or removed a barrier to the access of care.
Wow, it's truly incredible. So Kenneth, though, you're talking about more basic medical care, though, right? We're not talking about major surgeries or cancer care or those types of things.
Well, I mean, so under our model, yes, it is the primary care, which is the piece that controls about 85% of one's spend. But yes, when we're talking about cancer care, yes, we have specialists in the community. When you're talking about surgeries, we have specialists and surgeons and ambulatory surgery centers in the community. But the model is RosenCare is the quarterback of that health system.
Gotcha.
And so not only are we sending those patients to those specialists, but we're controlling that entire system to make sure they're getting the best care that they can get.
So, Kenneth, how will Osceola County Schools benefit from switching over to what RosenCare provides?
Well, so over the 28 years, we've been approached by public sector and private sector and giving them advice on how we can help them control their costs, how to improve their healthcare system. So as we've been approached by Osceola County, that's what we're going to be bringing to that program. Our goal, our desire is to improve access, quality, service, cost, and bring more innovation so that those teachers have the opportunity to stay in their classrooms but to reach optimal health. The benefits? Let's lower the cost of care, the whole cost of care, so that those teachers can have the funds, so that the school board can have the funds to give to the teachers to provide the care for the children that are there in Osceola County. We've got to help the teachers. I heard on the news the other day that more teachers are spending more of their own money. Let's give the resources back to the school board so that they can use those funds that we save on the healthcare system for anything that they have in their hearts.
Well, Kenneth, one of the stories that we've also been doing recently is talking about the negotiations the Orange County teachers are having and with their raises. And one of their big beefs with the contract, why they didn't want the last contract, is because they said the cost of their health care actually outweighed any benefit they would get from getting that raise. Is that something that you guys will now go to other school districts like Orange County and say, hey, we can help?
God willing, that's exactly what we want to do. I mean, for those teachers to say, well, we're not going to accept that contract only because of health care, we can do a better job with that. We've got to get to these municipalities and to help these teachers and get them the raises that they need without moving it or shifting it from health care or to health care. They can't afford this. We've got to lower the cost of care. We've got to make it more accessible. We've got to improve the overall outcomes and let the teachers do what they need to do. But we can't give them a raise and then all of a sudden we're going to raise up the cost, their cost and their premiums and their deductibles and co-insurances. We all know that when you have higher deductibles and co-insurances, it can lead to higher costs because 30 to 35% of Americans are delaying care, and that's not acceptable.
Right.
We've got to do a better job.
Absolutely. Well, listen, we certainly appreciate you explaining it to us this morning. It is truly fascinating, and I can't wait to see how it plays out for Osceola County Schools. Kenneth Aldridge with RosenCare, thank you so much for being with us this morning.
Thank you.